Hi everybody, my name is Dr. Rebecca Medansky and I am a pelvic floor physical therapist and the owner of Ladybird Physical Therapy, a clinic in Austin, Texas that specializes in helping people manage pregnancy pains, prepare for birth, and recover postpartum. And I am coming to you today from my bedroom, hiding from a screaming baby, to talk about the Emsella, which is a tool that we're starting to see more and more recommended to our patients experiencing symptoms like stress urinary incontinence, pain with sex, difficulty orgasming. And today we're going to talk about what this tool is, how it works, what it's often being recommended for, as well as what the research actually says it's good for. And then I'm going to get a little dreamy on you and I'm going to talk about where I think this tool could be used best in the future. Now, if you've heard pelvic floor physical therapists talk about this tool before, you've probably heard them trash talk it. In fact, I have previously trash talked it. So I wanted to make sure before I recorded this video that I actually went and understood the evidence, because it's a tool. And just like all tools, tools can be used well, they can be used poorly. What matters is that you have the right tool for the right job, as my neighbor, who's a very good handyman, always tells me. And so we're going to get into some of those specifics today, and I hope that the information in this video will help you figure out whether this tool is something you might want to consider or whether it's not. So let's first start with what the Emsella is. The Emsella is a high-intensity focused electromagnetic stimulation device. That is a lot of words. So this is how it works. There's a coil that they've built into a chair. Somebody comes and they sit on the chair, making sure that their perineum is intact with the coil, and this coil delivers this frequency up into the pelvic floor that they claim triggers the equivalent of 10,000 pelvic floor muscle contractions, submaximal pelvic floor muscle contractions, which as a pelvic floor physical therapist, I have a lot of feelings about, as do a lot of pelvic floor PTs, which is why you hear it trash talked by pelvic floor PTs so frequently. But again, we'll talk about that later. So that's how this works. You sit on this device, it triggers pelvic floor muscle activation. Now, this tool is frequently recommended to my patients who, like I said, have incontinence, have difficulty orgasming, have a wide array of pelvic floor symptoms. But the thing is, this tool has really only been studied in a specific population, and that population is people having incontinence and primarily stress urinary incontinence. I did look for studies that looked at other types of incontinence, other types of symptoms, and we'll outline some of those studies in a little bit, which is why I have my laptop with me today, because I'm going to have to read off my computer to go through these studies with you. But it's really been primarily studied in the stress urinary incontinence population. But let's talk about what the research says for that population as well as for other symptoms, so that you can make the decision yourself on whether or not this tool makes sense for you. So like I said, most studies look at for stress urinary incontinence specifically, but we'll look at a little bit beyond that today. So I found one study that took 75 women who showed symptoms of stress urinary incontinence, urge urinary incontinence, and mixed urinary incontinence. We're going to pause for a second so I can outline the difference between those. Stress urinary incontinence is when you cough, you sneeze, there's downward pressure, and you leak. Urge urinary incontinence is when somebody gets a strong, sudden urge to pee, they can't hold it, and they leak. Stress urinary incontinence is more likely to be caused by weakness, whereas urge urinary incontinence is more likely to be caused by pelvic floor tension or bladder overactivity. And then there's a mixed version of this, a mixed urinary incontinence variety, and that's when somebody has both. So that's the difference between those. So this looked at 75 women who had all different types of incontinence. They treated them for 6 sessions. Each session was 28 minutes long, and they evaluated their symptoms at the 6th session as well as a 3-month follow-up. This study had pretty great results. They had an 81% reduction in symptoms overall. The average improvement was 50%, the highest level of improvement was 69%, and 70% less pad usage. So overall, great results. They didn't have anything longer term following up though than 3 months. So that's the biggest drawback of this study. Now, another study had a longer follow-up. It looked at stress urinary incontinence and urge urinary incontinence, and they found that both of them improved for the first year, which is fantastic. But then they followed their study participants up to 3 years, and they found that there was a gradual return to baseline. So same quick improvement in symptoms early on, unfortunately, a return to baseline just a few years later. Another study looked at symptoms associated with weakness. So this study looked beyond just incontinence. They also looked at difficulty orgasming. They looked at some discomfort with sex. They used 10 sessions, all lasting 28 minutes, and they did this 2 to 3 times a week for 4 weeks. They had 95% or 95 participants, and like I already said, there was an ability to achieve orgasm, incontinence, and they included vaginal laxity as a symptom. And they found that they had improved contractile abilities, meaning their muscles that could not contract very well prior to this treatment, after 10 sessions, contracted better. And additionally, they found that people reported on a questionnaire that their symptoms were better. But again, there was no long-term follow-up. So what we see when we look at a lot of these studies is there are improvements. There is a lot more evidence saying that this is helpful for stress urinary incontinence than these other symptoms. But I wanted to call out some specific studies that looked a little bit beyond just that. So despite the fact that the Emsella is frequently criticized, and I do think it deserves that criticism, and I'm going to go into that in a little bit, there is evidence to suggest that in the short term, it can help people with significant incontinence symptoms, which is fantastic. Now, the problems are we have really limited long-term data, and the long-term data that we do have isn't very promising. The reason that matters even more, because if you're thinking, I could go to the doctor for 6 to 10 sessions and have a significant reduction in incontinence, maybe that's worth it. The reason why I'm going to call out that maybe that's not the case for the average person, or I'm going to say kind of blanket statement is likely not the case for the average person, is because the cost of this treatment is pretty cost prohibitive. Insurance does not cover it. And an average treatment, I've been able to get quotes from anywhere from $1,500 per session to $300 to $500 per session. So we're looking at $3,000 to $5,000 for treatment that gives improvement in the short term, but then returns to baseline potentially within a few years. We can't say this for sure across the board for any individual person, but looking at the data, I think that is a realistic and reasonable expectation for people. So what's the alternative to a tool like the Emsella? That's where pelvic floor physical therapy comes into play, right? People are going to their providers. They're saying, I have incontinence, I have inability to orgasm, I have vaginal laxity, heaviness in my pelvic floor, prolapse. And their provider is saying, well, we have this tool for you. The alternative is something like pelvic floor physical therapy. Now, this is where my bias is going to show because I am a pelvic floor physical therapist, and this is the common criticism of pelvic floor physical therapists about this tool. Not all of those conditions require Kegels. In fact, we have some pretty strong evidence in the pelvic health world that Kegels are not nearly enough to address long-term symptoms like stress incontinence, inability to orgasm, any sort of pelvic floor muscle weakness condition. And that is why I suspect we get short-term results with this tool, the Emsella, and then this gradual return to baseline. Because what most of those conditions require is, sure, pelvic floor strengthening, but also full body strengthening, core strengthening, hip strengthening, progressive muscle training, so that people are getting stronger overall, not just in this one isolated area, as well as habit changes. Oftentimes, the reason people experience symptoms like stress incontinence, urge incontinence, difficulty orgasming is because of habits that are at play or habits that are not at play. And making sure that we're approaching these symptoms holistically improves the longevity of the results that we experience. So that's my assessment of Emsella versus pelvic floor physical therapy. But with that said, pelvic floor physical therapy, as with almost all conservative treatment, requires time. And that for a lot of people is very frustrating because you're putting in the effort and you have to work pretty hard for an extended period of time to get the outcome that you want. It's the same way with any fitness program that any of us have started, any dietary changes that any of us have started, right? These aren't quick fixes. And so I could see in a perfect world, and this is what I would love to see in the future, and maybe someday we will, where we get a tool like the Emsella that gives us those quick short-term improvements. Because for somebody experiencing stress urinary incontinence, the impact that has on people's self-esteem, on people's willingness to be social, on people's overall health is substantial. And if we can have a tool that can fix that quickly in the short term and then give them the support to make sure that they're getting better in the long term, that would be the perfect world, right? Where we get these quick, fast results, and then we teach people the skills that they need. We give people the tools that they need to get the long-term impact on their overall health as well. But in order for that to be a thing, we're going to need to have more accessibility for these high-intensity electromagnetic stimulation treatments. And right now that's just not the case. But as with all things, typically when they're newer on the market, they're not covered by insurance, they're more expensive. And then over time that improves. We've already seen that in the pelvic health world as well. So that is my summary on the Emsella. I'm going to link the research articles below. Please feel free to comment with questions. But in general, I think that this is a tool that could have promise for certain populations. I think it's over recommended for people when we have no evidence to suggest it can help their symptoms. And generally, I think that the longevity isn't quite there, which is why I still think that pelvic floor physical therapy is what's going to impact people's long-term health. I hope this video is helpful for you, and I hope that you have a great day.